Hello and welcome to Breast Friends Cancer Support Network. I am Michelle Beck, a two-time 10-year survivor of breast cancer. I'm the patient programs assistant at Breast Friends of Oregon. And when I have time, you can find me on social media at I Never Liked Pink. Not very often, but sometimes it's good to get on there. Especially right now, this holiday season, and as we move into January, things are just busy. But I'm so thrilled today to welcome my guest, Dr. Eryn Kirschbaum. She's a trained doctor of physical therapy, focuses on helping patients suffering from pelvic floor dysfunction. And this is so important, especially for those who've gone through treatment for breast cancer, because I can speak from experience because, man, that really messes up our bodies. And you would think, oh, well, if you have breast cancer, why does it mess up things down there? Well, let me tell you, it does. So, as a therapist, Dr. Eryn strives to really listen to her patients and her concerns and goals. And she's definitely not just about making sure like you get an appointment. She really wants to know your life and works towards a holistic approach to healthcare and is so passionate about improving her patients' quality of life. And she has been doing this for a long time. She's taken numerous education courses, specializes in the treatment of prenatal, postpartum, pelvic floor dysfunction, bladder and bowel dysfunction, prolapse, pelvic pain, so many things. I just could go on and on, but she has a special interest in oncology and has taken additional courses to do that because she's really passionate in helping those move forward and beyond. So she's a Portland native and loves her hometown, yoga, football, skiing, reading, traveling, and wine tasting, which is one of my favorites as well. So Dr. Eryn, welcome. Thank you for being here today.
Yeah, thank you so much. I'm so glad I can be here.
So is there anything that I missed that you want to throw in there in your intro?
That was a really good synopsis of like my life. Yeah, I am a pelvic health, pelvic floor physical therapist. It's truly my passion, what I've been doing my whole career. So that is what my bread and butter. And another or a big part of that is providing education to the masses, just to let people know that it exists, because I think there's a lack of knowledge that this is a part of healthcare that is a resource for people.
Well, as we titled our episode today, things that you might think that are normal or common aren't necessarily that, and there's ways to fix a lot of the problems that we have. And I'm going to throw in my little personal tidbits throughout, but I'm one of the reasons I'm so excited was to have Dr. Eryn here today is a few weeks ago or back in October, she was a educational speaker at our luncheon at Breast Friends, and the feedback that we got, Dr. Eryn, for you was so amazing. Women were walking out of there going, I never knew. I never knew that this wasn't normal and that I could work on healing this area because unfortunately it's something that we're not talking enough about. And
Mhm.
having you here today, because I didn't get to sit in and listen. So I'm thrilled to learn more because I've
Yeah.
got issues. So
Yeah.
there are songs
Good.
about that. So
Yep.
let's dig into what we can talk about today. So pelvic floor. I know after my pregnancy, I've been diagnosed with cancer twice, 10 years of endocrine therapy. I know that I've got things going on. But for those not in the know, how would you describe pelvic floor physical therapy?
Yeah, it is a sub niche, or I should say niche or subfield of physical therapy. So, pelvic floor physical therapists are physical therapists first and foremost, but we have specialized training in pelvic health. And so, it started actually in the 80s, and it has been incredibly slow to grow. Just like you said, there are still a majority of people out there that have never heard of it and don't know it exists. And it has been around now for 4 decades. It started mostly with the treatment of like pregnancy concerns, and then from there has just gradually grown in terms of just the research being done. Unfortunately, still isn't as robust as we would like it to be, but it's getting there. And in terms of just yeah, people's knowledge of it, so slowly but surely we're getting that information out. But it is a subfield that helps to address a bunch of things that we'll talk about coming up.
Well, and one thing my mom friends and I always joke about is especially after kids and I've only had one and it wasn't even vaginally, but it still messes things up in there. And it's like, oh, you laugh really hard, you pee, you cough, you pee, you sneeze, you pee. I mean, that's just one example of the things that I know you can help work on.
Yeah.
So you obviously have extensive schooling. What did you do to really get into the oncology field and make that one of your specialties?
So, well, pelvic PT in general is something you do after your graduate. So physical therapy is a 3-year doctorate degree, after you have done undergrad, obviously. And then from there, it's starting to become where I think there's electives in grad school that people can choose to dip their toe in the water of interest of pelvic health physical therapy. But you can't specialize it in PT school. It is a post kind of doctorate training that there are a couple different routes in the United States for someone to go. So I went the route of an institute in Seattle called Herman and Wallace. Many people do that. And they offer a huge amount of courses and classes for practitioners. And it's not just limited to physical therapists, actually. It's anyone who has within their scope of practice to be able to do it, like occupational therapists, nurses, other practitioners. So that is how I became a pelvic PT and training for that. And then there's certain classes that you get the foundational knowledge that you can then sit for your board exams to become specialized. From there, then you can choose to start taking different classes about lots of different specialization topics. And they offer classes on the connection between oncology and pelvic floor. And so I chose to take one of their classes on that to be able to increase my breadth of being able to help patients with.
Now, when you're saying pelvic floor, what does that include actually in our bodies?
Yeah. So the pelvic floor itself is meaning the muscles. However, the pelvis in and of itself is a highly intricate area. And so the muscles create, and I actually have this pelvic model that I use a lot with my patients because it is such a complex area. To be able to visualize it is really helpful.
So listeners, if you're just listening, please go to the Breast Friends YouTube channel and watch this part of the video or all the videos so you can see what Dr. Eryn is holding, because it's like you have those skeletons you have in science class, but this is way more advanced because it's the pelvic area with the bones and the muscles, and there's blue things in there and all, and she's going to talk about all that. So you definitely go watch the video.
All right, so we have this pelvic model. The pelvic bones create a big shape like a bowl, but the bottom of the bowl of your pelvis is not bone at all. It is comprised of soft tissues, namely muscles and skin and fat and fascia and ligaments, all these things, right? And the muscles themselves, there's technically 3 layers of the pelvic floor. There's one that's a little bit more outside superficial. There's ones that are near a little bit closer to the urethra. And then there's a deeper layer here. And they have different functions. So a really big function of the pelvic floor is stabilization, because the muscles go from our sits bone to our sits bone. Those are those little knobs you feel when you rock side to side on your glutes. And then they also go from your front pubic bone all the way back to your tailbone, which is essentially the very, very base of your spine. So they connect back there. So they really create kind of a diamond shaped bowl at the base of your pelvis. So they are always, responding to movement. So they're helping to stabilize us. The other thing that they help us with is support of the pelvic organs. So on this model, and this is a little bit harder to verbalize, but inside that pelvic bowl, we have organs, also called viscera, but organs, right? So the bladder sits like this little balloon muscle right behind your pubic bone. And then right behind that, we would have the vaginal canal, and then the uterus above that, and then the ovaries on either side, which sits kind of right behind the bladder.
Looking at that, it's amazing because I always think of the uterus as like some big giant organ. And as long as you're not pregnant, it's not.
Yeah,
it's pretty small.
It's
totally smaller than your bladder in that model.
Yeah. They're both small until they're expanded either with urine or with the baby. And then the rectum, which is essentially the end part of the colon. The colon is is considered the large intestine in the abdomen. And then once that structure dives into the pelvis, that becomes the rectum. And then the anus is where it empties outside of the body. But the rectum is behind everything. So all of those organs are situated really specifically within that pelvic bowl. And so these muscles are a component of what are helping to keep those organs where they need to be.
And that looks like such a tiny area. You don't think, I mean, it's like if you're visualizing it like, okay, the size of a baby's head, all this stuff is going on in that area.
Yeah.
So
And
those
everything else has to
muscles,
kind of get out of the way and move and
right.
shift and
So those
mhm.
muscles need to support a lot.
Yeah.
How so they have a very important job, those three different layers of the muscle structure. How do you know if something is off or not normal with your pelvic floor?
Lots of different signs that a lot of people wouldn't really recognize. There's the obvious, well, what I think of as more obvious, where if you're struggling with any accidental leakage, in terms of urinary leakage, even stool leakage, we'll talk about later in terms of why people don't talk about these things, but I think there's a lot of shame involved, embarrassment, right? We just don't talk about them, let alone bladder, but starting to talk about like bowels, right? That's, I think for most people, that's a little bit more hush hush. But if any leakage is happening, any other bladder stuff like urgency frequency, feeling like you have to go to the bathroom way more often, that can actually be a signal that your pelvic floor is having some issues, not necessarily your bladder. Um, any pain down in that region in terms of whether that has to do with intimacy or sexual intimacy or not, or sits bone pain, tailbone pain, vaginal pain, any sort of pain that can tell us something's going on down there. And then, like I said, bowel dysfunction. So sometimes constipation, a sense of heaviness or pressure. I see that a lot more with like postpartum folks, if they're having some prolapse, which we'll talk about later, but a sense of something just not feeling right down there. And when I say down there, it's literally like that entire region, like from your pubic bone to your tailbone to your sits bones, and even in your lower abdominal area. Sometimes that can kind of signal something going on with the pelvic floor.
And so if someone is I would imagine most everyone can benefit from some kind of pelvic floor therapy, even those who don't think about it, because we've all had, and especially as we get older, our bodies change and age. And yay, we're living longer and longer lives, but the longer we live, our bodies don't function as well as they used to.
Mhm.
So, but so obviously you talk to those people who could sense all those dysfunctions or have them. So this is a very long way to a roundabout question. Who can benefit from pelvic floor therapy?
Mhm. I mean, truly anyone. Every human has a pelvic floor, and so there can be dysfunction, from even an early age. I personally don't treat pediatric pelvic physical therapy, but that exists. So even from a young age, sometimes kids can struggle with that, which can be issues with constipation or nighttime bedwetting or leakage or things like that. So really, from a young age, that can be present. It can happen in more of the teenage years in terms of females or girls if maybe they're not sexually active yet, but they have what we call vaginismus, which is a narrowing and a tightening of the vaginal canal. For example, maybe they're a swimmer and their swim meet comes up on a time that they're menstruating and they can't use a tampon. Therefore, they can't wear a pad when you're swimming, right? So
Mhm.
that's going to not allow them to compete or do what they love to do and swim. So there's other things I think people don't think about necessarily with that, that how the pelvic floor can impact one's life kind of through the younger ages all the way up to older. So really it's any age of the spectrum. And as you said, as we get older, it really does, things change, especially if there's been any pregnancies or deliveries, or any traumas or any surgeries, right? The more the pelvic floor becomes impacted, as well as all genders. So every human can benefit from PT, pelvic PT.
Now, obviously, the muscle you or the model you just showed us is of someone who was born female with
Mhm.
the female organs. Um, can someone born male benefit from pelvic floor therapy as well? Because obviously things are different inside.
Yes, absolutely. The biggest things that I treat with people born with male anatomy are chronic male pelvic pain syndrome, which also has been titled non-bacterial or abacterial prostatitis. It really doesn't have to do much with the prostate in and of itself. It's just kind of a name that's given because everything else has been ruled out. And what the symptoms of that is, pelvic pain, sometimes, oftentimes urinary urgency frequency, sexual dysfunction, things like that. And that really can be a pelvic floor muscle issue. as well as a nervous system issue, which I think we'll talk about in a little bit, as well as, and speaking of cancer, a man who's had their prostate removed, a prostatectomy from prostate cancer, they can struggle significantly with urinary leakage after that. And so a subset of guys will heal well and not struggle with incontinence or leakage at all after prostatectomy. But there's a subset of guys who will struggle with it and think that there's not anything they can do about it and just to live with it and wear adult diapers for the rest of their lives. But I've worked with numerous men who have had that and helped them to gain their continence back. So that's a really, really cool thing to be able to help with.
That is huge, especially, and this is a huge generalization. I know from experience that most of the men in my life do not like to go to doctors, and especially with anything in that area, they're like, I can handle it. So props to those who go out and actually
Yep.
are proactive and take care of themselves because it's so important. Like you said, anyone can benefit from this type of therapy. And that's what I always say, like anyone can also benefit from having a therapy for your brain
Mhm.
because this is just part of life. And we have so much more to talk about. So, listeners, please stay with us. We're going to take a break. If you would like to help Breast Friends on its mission to ensure that no one goes through cancer alone, you can donate on our website, breastfriends.org. There's a big button, or you can text BF Radio to 41444. Stay with us. We'll be back with Dr. Eryn in just a minute. Thank you for staying with us. I'm Michelle Beck. My guest is Dr. Eryn Kirschbaum, pelvic floor therapist specialist, and that was the wrong wording, but that's the way my cancer brain
Fine.
works.
It works.
So, Dr. Eryn, we just finished up talking about how really everyone can benefit this, but the majority of our listeners are cancer survivors or thrivers. How can this area especially be affected by cancer treatment and possibly radiation of that area if someone is going through cervical or ovarian cancer?
Yeah, I was going to say if it's obviously more of a gynecological cancer and there has been radiation to the tissues, that region can be highly impacted. There is as we saw in the pelvic model earlier, there's a huge connection between the muscles and the tissue and the organs, which is different from other parts of the body, right? If you think about your neck or your shoulder, we don't have an organ living in your neck or shoulder per se, right? There's not a bladder in your shoulder. And so there's such an interconnectedness of the pelvis where any sort of trauma or change to the tissues around those organs can impact it, right? Your bladder function, your bowel function, your ability to, enjoy intimacy or sexual, intercourse. So if it's directly related to that, we can help people safely kind of reconnect to their body, learn how to use different tools to help sustain their vaginal or their pelvic floor function or their vaginal function for as long as possible, to retrain the bladder. Another component when it's just generalized, if we're not talking specifically breast cancer, but any sort of cancer, is the stress that induces in the body. And we know more and more now that and how stress impacts the entire system of our body, but we know even more now that the pelvic floor loves to hold on to that tension because of that stress. And so a huge part of what I do for all my patients, let alone being a cancer survivor, is working on getting the nervous system to calm so that the pelvic floor can actually kind of regulate and do its job. Because I find most people, when they've been under any sort of trauma or stress, the muscles of the pelvic floor get overly tight, which leads to its own dysfunction. Because just like a muscle that's tight doesn't mean it's strong. A muscle that's tight means it's exhausted and fatigued and tight and painful and irritated, right? So I think that's a big way that we can help anyone, that's a cancer survivor.
And in terms of breast cancer specifically, I've been through a lot of pelvic floor dysfunction because I've been through 2 cancer diagnoses. I was on endocrine therapy for 10 years, and 5 years ago I had a surgical menopause. I had my ovaries removed. So the medication takes out the estrogen, and I had my ovaries removed. So the lack of estrogen has really taken its toll on that area for me, and it's something that is 5 years later, it's still a work in progress for me. Because your vagina and the vulva, they want estrogen. And
They
when they
love
don't get it,
estrogen. Yeah.
they want to close up and say, I'm closed for business.
Yeah.
How would you talk to a patient who's coming in with these symptoms?
Yeah, I would obviously they probably have an idea already, but I always talk about that where, estrogen, systemic loss of estrogen impacts all areas of the body, and specifically the vulva and vaginal tissues. They really like that. That allows for them to stay moisturized and plump and healthy. And so with those treatments, the vaginal area it's dry, and it really impacts, discomfort and again, sexual ability and the bladder and whatnot. So we talk about, there's different thoughts out there. There's research being done in terms of the safety of using a very small amount of topical estrogen for those tissues. I'm hoping there's more and more research to be, continues to be done, because it can be so beneficial to have a small amount of topical estrogen down there. I feel like from my research and what I've learned over the years is that for some people, it can be safe to use that small amount. It just really is a conversation that I always encourage the patient to have with their oncologist or their primary care or whoever it is, to have that discussion. But other than that, there's other types of kind of topical, hyaluronic acid, vaginal creams, and different, compounds that we can use down there to help the tissues just to kind of bulk up. Because the other thing is, you don't think about it necessarily for the bladder, but the urethra, we have a muscle, a circular muscle around it, as well as a couple other muscles that surround it that are helping with continence. But another mechanism for being continent, meaning not leaking, is the bulk of the tissue around the urethra. It just kind of has all this bulky stuff around it that just kind of smushes and helps to kind of keep that closed. But when that is drier and lacks that's one reason too that people can struggle with some of that leakage. So we talk about that. We talk about if someone's wanting to return to intimacy in terms of any sort of vaginal penetration. We talk about really safe ways to use vaginal dilators, which are a way to slowly and safely increase both the vaginal width and depth to allow for that. So it's definitely something that we can help.
I've definitely been down the road of everything you just mentioned. And I actually also have a home tool that I use for loosening up some certain areas. I've worked with various gynecologists and naturopaths and my myofascial therapist, and but you're next on my list, so I'm definitely making an appointment for next year, because it is so important. And especially for myself, I've been through a lot because of the cancer. But also, one thing I do want to touch on that you mentioned is that our muscles, they remember things as well, and they remember the trauma. So when you're going through this and say you're having problems with vaginal atrophy and the dryness and everything down there just kind of hurts, and you try to have intimacy and vaginal penetration and that hurts, your brain remembers that. So how do you it's impossible, even when you think, oh, I'm feeling better and I've done all these things, your body still remembers, oh, it hurts. And then it's like it's hard to relax and it's hard to get through that. So I think coming and speaking to a professional like you, and you can explain like, okay, this is why, this is how it happens. So I'm assuming in an initial appointment that you come in, talk to you about all of the symptoms and the different things you might want to try. Do you also do like a physical exam on the first appointment?
So every pelvic PT probably does it differently. I personally, obviously only with consent and after a lot of education, usually will do a pelvic floor muscle assessment on the first visit. It definitely starts with history taking and getting someone's story. Like you said at the very beginning, I really like to have a good understanding of the background, because I think there's so many things we can find out in someone's history that are going to give us clues as to what I can kind of anticipate and expect, instead of being rushed through and feeling like you're really not understanding the person. So always start out with a chat to learn about the person and what their goals are and what they're experiencing and all that. Then I take this beautiful model that I just showed, and I do an anatomy lesson so that people have a better understanding. Because I think that in and of itself is huge, because most people don't really have an understanding of how it's all interconnected down there. And just that sense of education and empowerment of like, oh, this is what's in my body, can be really helpful. And then I'll explain based on that model kind of what I would do for an assessment. And then obviously after that, ask if that's something that they feel comfortable doing. And for the most part, most people say yes once they understand the concept of it and why. They're like, yeah, I just want to get better. So do what you need to do. If for some reason someone's like, I'm just not comfortable with that today, then that's fine. We'll work on other things. There's plenty of other things we can look at in terms of how someone's breathing, what's their diaphragm doing, what's their back doing, what are their hips doing. all these other things influence the pelvic floor. So we can look at plenty of other things. But if they are coming in with really specific complaints of things happening in the pelvic region, my perspective, and again, every pelvic PT is different, I talk about a zoom in and zoom out kind of concept. I zoom in because if someone is truly experiencing leakage, if that's their main thing, then the urethra and the bladder and the pelvic floor are right there. And that is the zoom in. We want to see what's actually happening in that region, and then zooming out, whether that's later that appointment or in the next visit, looking at all these other things kind of up and down the chain. Like looking down, looking up, looking all around the body. But if someone does consent to a pelvic floor assessment, essentially what we're doing is, like if someone came in with with neck issues, the physical therapist wouldn't just look at their neck and say, oh, like this is what you need. They would watch them move. They would put their hands on the patient and kind of feel the muscles, feel the fascia, feel the joints. The same thing is in the pelvic floor. It just happens to be in an area that's less familiar with getting palpated by a professional or provider. And so, explaining that, but essentially we would kind of feel the muscles on the outside, visualize, especially if it's a cancer survivor, to note the tissue quality. And then if they're agreeable, we would check the inside muscles, because we can get to that deeper layer. Get this layer out again here. We can feel through here on the outside to give us a snapshot of what might be going on. And then if we're able to insert one finger vaginally, that allows me to feel what's going on in these deeper layers of muscles, which are influencing a lot of other things. And then just checking to see, what's their connection to the pelvic floor? Can they engage? Can they relax? It's more complex than that in terms of just function of the pelvic floor, but that at least gives me a snapshot if someone has any idea where their pelvic floor is, how to connect to it, what happens when they take a deep breath, so we can kind of get that real, true, objective information from that.
I was actually amazed when I had my first pelvic floor exam. My myofascial therapist does it as well, and she's also a friend of mine. And so it was easier for me because I'm like, okay, and we're just sitting there chatting. But I was amazed at the palpitations that she was able to do and say, okay, this area is tight. This area over here is tight. And literally, like, I could feel the release from the gentle pressures that they were doing. So what you do is so important, because she has helped me so much, and you're going to continue to help me going forward, because it's a long process. And unfortunately for me, I'm not putting, I do use topical estrogen as needed, because I've made that choice in consultation with my oncologist. But reclaiming that part of my life is important. And thankfully I don't really have too much leakage, other than the random I'm laughing too hard that I pee, which is, I'm not mad at that, because that means I'm laughing with my girlfriend.
Laughing so hard, right?
Yeah. But if someone comes to see you that first appointment, and how long do you typically see someone, like, over the course of time, to help them hopefully work through their issues and give them some guidance on how to move forward?
Yeah. So all of our appointments here at Mendwell are an hour. When we opened about a year ago, and I just really wanted to start a clinic with a team that allowed me to do my job. Because in the past, as much as I love the humans I've worked with, I just didn't feel like where the places I was at allowed me to do a quality job. And so I felt rushed. I never felt like I could really connect to people. I couldn't do a thorough examination. I couldn't do thorough education. So I found over the last year, and working with patients and having hour-long appointments just with me every time, whether that's the first visit, the second visit, the third, all visits, I found that people are getting better faster. Shocker, right? Like, when you can actually do your job, and that people are really motivated because you've explained, right? You've educated on the why behind what we're doing. Then people have that sensation of like, oh, I understand why I'm doing this. Therefore, I'm going to be more motivated, and there's more buy-in. And so I find that where it used to take, you think about traditional physical therapy, right? They're saying, oh, come in 2 times a week for 6 to 8 weeks and all this. And you're seeing, 20 visits and all that. And there would be sometimes I'd be like, do I even know what I'm doing? Because people would come in and just, not really making progress. And I knew a lot, but I was like, is there something I'm missing? And now that I realize, and of course I'm always learning, I don't know everything by any stretch of the imagination, but I feel like I'm a pretty competent therapist. And now that I'm able to actually like dive deep and get really good information and give really good education and all these things, that people are getting better faster. So it really depends on the condition someone's coming in with, right? If it's a pelvic pain condition that's been present for years and years, that can take more time. If it's someone that has really mild incontinence and doesn't have a cancer history and maybe hasn't had kids and just maybe they do CrossFit and they have put a lot of pressure down on that, then that can sometimes just be a little tweak of like breath coordination and a few things, right? Where in a visit or two, they've kind of like, oh, okay, this is helping, or postural changes, things like that. But if it's someone that has pretty long-term persistent pelvic pain or conditions like endometriosis, which pelvic PT can't cure that, but we can be a part of the team to help with. Those are things that can take longer. But in general, I find that my patients have significant improvement in whatever symptoms are coming in for like 5 to 8 visits, something like that in general.
Perfect. And you had mentioned it briefly, and I was remiss in not saying it. So you're at Mendwell Health in Lake Oswego, Oregon. Do you do any type of consultations if someone's like, oh, I don't want to commit to a full appointment? Can someone just chat with you or someone else in the office before coming in?
Yeah, we have free phone consults. So if someone's interested, and I think that's super helpful because a lot of people have some anxieties or just apprehensions or just curiosity of what the heck this type of therapy is. And so I can get on the phone with people and just kind of talk about their history, their background, and then explain how pelvic PT might go about helping them. And most of the time people are like, okay, yeah, that makes sense. And then they feel more comfortable making that appointment. Yeah.
Perfect. Well, we have so much more to talk about with Dr. Eryn of Mendwell Health. So, listeners, stay with us. If you would like to be my guest or submit your warrior story or just reach out to me with a comment or a question, I've been getting a lot of those lately, and I love it hearing from all of you who benefit from the show. Please email me at michellebeck@breastfriends.org. We will be back in just a minute. Thanks for staying with us. I'm Michelle Beck. My guest is Dr. Eryn Kirschbaum of Mendwell Health, and we are talking about what is normal, not normal, and what can we do for pelvic floor dysfunction. So, Dr. Eryn, if say you're having a consult with someone or even an initial appointment, what is the biggest advice you can give for someone struggling with pelvic floor dysfunction?
Gosh, a piece of advice. I mean, if I'm already talking to them, they already have reached
They've
out.
already made the first step, which is
They
good.
made the first step, right? Yeah, because I think that the biggest piece of advice or just knowledge is that there is a specialty of pelvic floor PT across the United States. And while there's more providers typically in bigger cities, hopefully there's more in smaller cities, but knowing that we exist and that there is a growing profession of it, that means that there are a lot of patients out there that need it. And so it's very cliche, but at the same sense that like you're not alone. Like there are so many people that struggle with these things. And so I think that that's honestly it, is to know that like just reach out to someone and even just have a chat, have a discussion and see if you can be helped. Because I think people just, live with things that they think
Well,
they
they
just
do. And it's funny. Funny in a not funny way. I just got an email from a listener recently who thanked me for being so open with topics like sexuality and talking about your body on the show because she lives in rural Virginia where they don't talk about anything. She's like, we talk about everybody else's business, but we can't talk about our own bodies. And so,
Yeah.
again, thank you for being here to share because not everyone has this access. If someone is outside of the Portland area, if they're here, obviously I want them to go to you. But is there a network or something they can search, like an organization, to find a pelvic floor specialist in their area?
Yeah, there is. And I'm seriously glad you asked that because I wanted to tell you this and make sure that all your listeners knew this because I'm only in one place. And like I said, luckily Portland, we are very, in certain ways, very progressive. And so we're, the word is out. We have lots of great pelvic PTs. But in other places, it can be really hard to find. And there are patients that will drive hours to go to a pelvic PT just for one visit, or they'll, fly somewhere to a specialty clinic. But yes, the institute that I mentioned earlier that I have my specialization through, Herman and Wallace, they created a website called pelvicrehab.com. and it is a general site where you can put in your zip code and then search. And anyone that's taken a class from them or has pelvic PT background will pop up as a list and show where they're located. It will also show on there if someone is certified. So when you search on there, it's hard to know, like, some pelvic PTs treat pelvic PT kind of like half the time, and others like me are just, that's all we do. And so you don't know exactly how much experience someone has on that. So you could just call around to different places if there are multiple options, and check. But they do have, I think on there, it will have, I believe it's a yellow banner kind of under a person's name saying like pelvic health certified, if they have their actual like special, like I do, right? Specialty training certification that takes, XYZ hours and tests and whatnot. Not to say there aren't other great pelvic PTs that don't have that. But just as an awareness, right, of who you're going to be seeing. But yeah, pelvicrehab.com.
Perfect. And why are you so passionate about this specialty? And how did you end up in school? You're like, I want to go on and work on this subset.
Yeah, so I was an anthropology major in undergrad, actually. I had no idea I wanted to be a physical
That's a
therapist.
little different.
Yeah, a little bit. And that inspired me to join the Peace Corps. And I lived in Ukraine for a couple of years doing the Peace Corps. And while I was in the Peace Corps, I realized I didn't want to be a teacher like I thought I wanted to. I wanted to be a physical therapist because that helped. It had the education component, it had the helping people component. And so when I got back from Ukraine, I actually worked at a clinic for a couple of years as an aide, like we all kind of have to get our, stuff under our belt. And the clinic I worked at had 2 women's health specialists. And so that was what piqued my interest initially. And I thought, wow, like this can really help impact people's quality of lives. And I'm not embarrassed talking about pee, poop, sex, whatever. That doesn't make me blush. And how I was raised, I don't know, as an open family. And thought if I can talk about that with confidence and comfortability, like, and this is a huge need out there. I mean, they had patients coming in constantly. I was like, wow, like there's so many people struggling with this. So that piqued my interest. So I knew from early on, even when I was in PT school, that this is what I wanted to do. And I think I'm passionate about it because of what I just said. It's helping people with quality of life changes, and having patients come in and say like, wow, for the first time by a practitioner, I feel heard and I feel validated and I feel hopeful. Like those words to me are like why I do what I do, because I've had a lot of patients come in that have been dismissed by other, they've said, oh, I have pain with sex. And their provider said, well, just use more lube, have more wine and
Yeah,
relax a little.
lube is always the answer. Lube
Yeah,
is not the
totally.
answer. I
No,
mean, yeah, I need lube,
it can
but
help.
I need other answers to these questions besides
Right.
lube.
Exactly. So things like that where they come in or they've, maybe even been to a different pelvic PT who didn't have as much training and maybe they were a really complex case. And so being able to explain what I think's going on and have people be like, you can just see that look of like I'm not a savior. I'm not magic, anything like that. But at least giving them that hope of like, okay, there are still things that we can work on. And it's different than a sprained ankle. That's what I kind of talk about where that's why I think, at Mendwell, this is all we do because I think it deserves that specialty and that time because treating someone's pelvic floor dysfunction is vastly different than treating, like I said, their sprained ankle or their ACL rehab. And while those can be, very challenging in terms of not being able to have your same mobility and it's a long recovery and all that. And I hear that's valid. But at the same time, you're working with someone that has a lot of layers and maybe has a history of trauma and maybe has a history of cancer and has multiple pregnancies and deliveries and maybe had a car accident years ago, right? There's so many layers that being able to, address those things, like these really quality of life, like you can't be intimate with your partner anymore. You can't run anymore, but you love running, but you don't anymore because you leak too much, or you're embarrassed to go out and about because you're afraid of your bowel leakage, right? Like those are things that innately impact your ability to be happy in life. And so I think that that's why I'm passionate because I'm helping with like those type of things.
And so you went out and started Mendwell on your own because you wanted to have this specialized place.
Yes, me, a couple other girls and I decided to start this clinic. So it's me and them, and we opened about a year ago, and we're just trying to, yeah, treat as, patients that come in, and we're trying to like, we do a lot of community education as well. Just like the Breast Friends event, luncheon that you were mentioning earlier was so neat to be invited to speak at. So yeah, really passionate about spreading that awareness.
And I love the title because, or the name Mendwell, because it's like, it's not something you hear all the time together, but it makes perfect sense.
Yeah, definitely. It worked
Yeah.
perfectly.
So I'm sure you have success stories, and that has to be probably the most favorite part of your job is helping those individuals and, graduating, for lack of a better term, but getting their solutions or their problems solved. What is that? How does that feel for you?
It's great because I feel like I'm actually getting to the root of it, right? I'm not just trying to put a band-aid over what they're struggling with. We're actually, and that's why I think it takes, time with appointments to peel the layers to figure out, a lot of times people are told, oh, just do Kegels. I think that's the buzzword. If I say I'm a pelvic PT and people don't have anything know what I'm talking about, the most people are like, well, you mean like Kegels or something? And
Which they don't
I
even call them that anymore. I know that.
no. Mhm. Yep, we don't call them that. That was named after a male physician in the 1950s who decided to name the
Yeah.
pelvic floor contraction after himself. So I call it a pelvic floor muscle contraction. A little bit longer, but worth
Mhm.
saying.
Yeah.
Um,
F the patriarchy. Oh, sorry.
yeah, yeah. So yeah, I just think that just being able to get to that root cause and get lasting change is why it's fun to do what I do. It can be hard. It's not easy. Definitely won't say it's easy, right? I mean, you have to really be able to look at all the different parts of the system and address the nervous system, and then make reference or referrals to other people, right? I love when my patients are seeing acupuncturists and or naturopaths or massage therapists. Thing like you mentioned, myofascial or fascial work, things like that. That is all impactful. But yeah, I just think being part of that team for my patients is really important.
Oh yeah, I'm all about like putting all the things together and figuring out what works best. The
Yep.
Western and Eastern medicine, because they're not they work together and they're very complementary. Like I see an acupuncturist regularly and the myofascial, and can add you to my team as well, because it's important to treat all of the different aspects.
Yep.
Um there are people who are like, oh, I can do all of this. Well, specialists are specialists for a reason. And when we have issues like pelvic floor dysfunction, it is so important to get that taken care of because, as you said, the leakage is not normal, and there's other things. What is the most common thing that your patients come in for?
Oh gosh. It would probably be a toss up between pelvic pain, and that is a massive umbrella of terms, right? That encompasses a lot, or bladder dysfunction. Those truly are, so I can't even say the number one. I'm saying or a million times. Core weakness is another one that
Mm-hmm.
really impacts pelvic health. So I work with a lot of people on kind of reconnecting back to their core, whether that it was after a surgery, and we didn't actually, I mentioned that earlier, in terms of any abdominal surgeries or even
Mm-hmm.
upper body, like mastectomies and any scar tissue and surgeries in the abdomen or the thorax, meaning the mid body, can impact the pelvic floor. So, getting things moving, making sure there's no scar tissue developing, making sure the diaphragm is working effectively, making sure your deep core muscles are working actively. That is really foundational, no matter kind of who I'm working with and for what diagnosis, because it all is so interconnected. So yeah, a lot of core rehab, as well as, like I said, any bladder dysfunction or pain.
Now, how would you address core rehab? What would you have a patient do?
I start with looking how they breathe. Breathing is truly foundational. And there, I mentioned the nervous system
Yes, I
component
was going to
prior
ask
to
about
that.
that next.
So it's all interconnected. That word, I keep saying it, but it really is. Your diaphragm is this dome-shaped muscle right up underneath the rib cage, and I like to think about that as being the top of our core, almost as if you think about your core. I use the analogy to a pop can. The top of the pop can is your diaphragm. The bottom of your pop can is your pelvic floor, and then you have all these abdominal and back muscles that create the cylinder that goes around it to complete the can. When we breathe, the diaphragm descends down when we inhale. which makes the pelvic floor also descend and relax down on the inhale. And then when we exhale, everything kind of just goes back up. But if there's been any sort of surgery, scar tissue, nervous system, meaning the sympathetic nervous system, which is our fight or flight, that diaphragm is influenced and it doesn't quite do it's limited in how it can breathe. And therefore we start, instead of breathing down into our core, we start to breathe up. And we get tightness in our neck and our jaw and our upper back, because every time we try to breathe, all these muscles that normally at rest should be at rest and relaxed start to do this, tightness. And then we get all this tightness here. And then we're not getting any of that breath and expansion and movement down into our abdominal core. And so looking at how someone's breathing is how I start. And if they are taking shallow breaths, we work on the diaphragm. If the diaphragm has not moved in years because of whatever reasons, then we can do actual mobilizations of it to release it. There's different techniques that therapists know that we can work to get that diaphragm. It's like, it's a muscle. It just happens to be this really interesting, cool dome-shaped muscle inside our body. And so we can help to essentially mobilize it so that when someone takes a deep breath, they can actually use it. And that is going to influence the pelvic floor inadvertently by allowing that pressure system to kind of go down into the pelvic floor. So we start with that. And then we look at how someone's kind of I'll just have them however they think they would. If I say, go ahead and contract your core for me, and I watch what happens. Then we correct it.
And then we correct it.
Because it's usually not quite right.
I'm sitting here doing all those things right now. I'm doing diaphragm breathing and I'm doing like neck breathing and I'm like tightening my pelvic. And I'm like, okay, all these things. Am I doing it right? Probably not.
Yeah. So I just look at it and I help people know how to do it right. So that's how we start. And then we just progress from there in terms of challenge and I look at the hips. The hips are part of the core too, if you will. I mean, they're a huge part of pelvic stabilization. So I'm looking at the glute muscles, the hips, how the hips are moving. All connected.
Wonderful. And Dr. Eryn, we are out of time. Gosh, I wish we could talk for days because this is such an important issue. But please tell our listeners where they can find you online and on social media.
Yes. Our website is mendwellhealth.com. I had to think about that, but I'm pretty sure I did all the time. Mendwellhealth.com. And that has a lot of resources. It has our phone number. It has a tab where you can say, contact us for a question, or if you wanted to do that free consult. And it also has online booking, so people can just book online easily. And then our Instagram is at Mendwell Health. So we are pretty active on there too, which is kind of fun to follow.
Perfect. Dr. Eryn, thank you so much for being here and sharing all of this important information. I know it will definitely be helpful. So listeners, again, you can find them at mendwellhealth.com and on social at Mendwell Health. If you or your loved ones need our services, please go to breastfriends.org. Oh, I forgot to mention pelvicrehab.com, right? That's where you can go and search for a specialist, not in the Portland area, but we've got Dr. Eryn here. So anyway, Dr. Eryn at Mendwell Health. But listeners, again, go to breastfriends.org if you need our services. Check out patient programs to see what we can do for you or a loved one. If you'd like to make a donation, there's that big button on the website, or text BF Radio to 41444. We will be back next week, but until then, you can find our past episodes on the Voice America Health and Wellness channel, wherever you get your podcasts, or any of the 2022 episodes on the Breast Friends YouTube channel. And that's also where you can go find this episode to check out the amazing pelvic model, which Dr. Eryn showed us. So please check that all out. Such good information. And we will be back next week. And until then, remember, we rise by lifting each other.